Vestibular testing for children developmentally 7 years and older. What to expect? Vestibular testing is a way to check the parts inside your ears that help you balance. We will ask you to do different activities based on how old you are. You may be more likely to have a vestibular disorder if you have permanent hearing loss. During your visit, you will work with an audiologist and their assistant. An audiologist is a doctor of hearing and balance. First, the doctor will ask you questions about your dizziness and balance. If you use amplification devices, please wear them for your appointment. You may be asked to take them out one at a time for some tests. Next, the doctor will check how your eyes move. This is called an oculomotor screen. They will also use a light to look in your ears and do a tympanometry test to check your eardrums. The first set of tests are called vestibular evoked myogenic potentials, also known as VEMP. These tests will check two parts of your inner ear. There are two types of VEMP tests, cervical VEMP, or CVEMP, and ocular VEMP, or OVEMP. The assistant will help you get ready for the tests. We will start by cleaning your skin and putting on small sticker sensors called electrodes. These are used to measure energy from your body. They do not hurt. For the CVEMP test, you will wear a bone conduction headband or earphones that will play a knocking sound in one ear at a time. During the test, you will need to lift and turn your head, and then stay in that position for 15 to 20 seconds at a time. Next, you will do an ocular VEMP test. This test uses electrodes under your eyes. During this test, you will look up at a picture for about 30 seconds at a time. After the test is done, we will carefully take the electrodes off. This may leave red spots on your skin, but they will go away. The next test is called Video Head Impulse Test, or vHIT. For this test, you will wear goggles that have a camera in them to watch how your eyes respond when you move your head. The goggles need to fit tightly, but we will make sure they feel comfortable. You can also do this test with a remote camera if the goggles don't fit well. You will look at a character while we move your head in fast, small movements. This test takes 5 to 10 minutes. Another set of tests is called oculomotor testing. For these tests, you will wear a different pair of video goggles. These tests look at how your brain and eyes talk to each other. You will sit in a chair that is either in a dark booth or in front of a TV. While wearing the goggles, you will follow a moving object or a light with your eyes. The audiologist will carefully watch how your eyes move during these tests. This takes about 5 to 10 minutes. The next set of tests are called rotational chair testing. For this set of tests, we will add movement to see how your ears, eyes, and brain work together. The chair moves slow and smooth for 30 seconds to 3 minutes at a time. We will keep the door closed and the lights off for each test. In between tests, we can open the door or turn on the lights, and the assistant will stay with you. During these tests, it's normal for your eyes to make quick side-to-side movements called nystagmus. The last test in the booth is called subjective visual vertical, or SVV. During this test, you will try to make a crooked line straight using a remote control. After the tests in the booth are done, you will have time for a break. For the next test, you will sit in front of the TV. We may do some of the eye tracking tests again at this time. Next, you will do the high-frequency headshake test. For the headshake test, we will help you turn your head side to side for 30 seconds and then stop suddenly. You will need to hold your eyes still while the audiologist looks for any small eye movements for 30 to 60 seconds. Now you will move to the bed for the last set of tests: the Dix-Hallpike test, static positional testing, and caloric testing. The Dix-Hallpike test looks for a disorder called benign paroxysmal positional vertigo, where the small crystals in your inner ear move to areas they're not supposed to be. Next, you will do static positional testing, where you lie down on a bed in different positions for 30 seconds at a time. You will need to keep your eyes still while the audiologist watches for small eye movements. The audiologist will tell you if you need caloric testing. This test is helpful if your other tests show vestibular dysfunction in one or both ears. During this test, we put cool and sometimes warm water into one ear at a time for 30 seconds. The change in temperature activates one ear at a time so we can compare them. You may feel dizzy during this test, but we will go slow and make sure you feel safe. When you're ready, the audiologist will count down and begin putting water in your ear. It's important to keep your eyes open and answer our questions the whole time. We will repeat this in each ear 1 to 2 times. After the test, we will remove the goggles and let you rest on the bed until any dizziness goes away. You should feel better after about 5 minutes. The audiologist will go over the test results and recommendations for next steps. They will also send a detailed report with this information through my chart within 1 week. It's important that you drink lots of water to help you feel better after testing. You may return to school or activities after the appointment, but you may have more dizziness or feel unsteady for the rest of the day. For questions or more information, please call the Audiology Clinic at 720-777-6801.